Several enzymes in nucleotide metabolism have been a target for a number of chemotherapy drugs. In this podcast, I will cover 3 important chemotherapy drugs that have been used for the past several decades. Nucleotide triphosphates and Deoxy Ribonucleotide triphosphates and Deoxyribonucleotide triphosphates are needed for RNA synthesis and DNA synthesis respectively. With the 4 nucleotides or deoxyribonucleotides have to be present in the cell in order for nucleic acid synthesis to proceed. Even if a single nucleotide or deoxyribonucleotide triphosphate is missing, this could impair nucleic acid synthesis, i.e. RNA synthesis and DNA synthesis. The former nucleic acids are needed for cell division, replication, transcription, translation, and so on. So they are needed for normal and abnormal cellular growth and division. If a single nucleotide is depleted or is not made in the cell out of the 4, then nucleic acid synthesis can stop. That means cell division, replication, growth will also stop. So this is essentially the strategy behind many chemotherapy drugs, which is to deplete one or more nucleotide from the cell or prevent it from being synthesized, thus slowing down cell growth and cell division. I will cover 3 target enzymes that have conventionally been used in chemotherapy. The first one is Dihydrofolate Reductase. This enzyme converts folic acid, a vitamin that we get from the diet, to tetrahydrofolate, the active form of folic acid. Tetrahydrofolate, in turn, is needed for the synthesis of adenine, guanine, and thymidine nucleotides. If tetrahydrofolate is not available, then adenine, guanine, and thymidine nucleotides synthesis will be impaired and their production in the cell will be significantly reduced. The drug that inhibits dihydrofolate reductase and prevents THF synthesis is methotrexate. In doing so, methotrexate can impair the production of guanine, adenine, and thymidine nucleotides, and therefore can slow down nucleic acid synthesis in general. The second target enzyme in chemotherapy is ribonucleotide reductase. This enzyme is responsible for converting ribonucleotide diphosphates to deoxyribonucleotide diphosphates. So it is very important in providing the deoxyribonucleotide triphosphates needed for the synthesis of DNA. The drug hydroxyurea is a potent inhibitor of ribonucleotide reductase and prevents the formation of deoxyribonucleotides and therefore prevents the synthesis of DNA. In depleting deoxyribonucleotides required for DNA synthesis, hydroxyurea will inhibit cellular growth, cellular division, both normal and abnormal cells, including the growth of cancer cells. The third target enzyme used in chemotherapy is thymidylate synthase. Thymidylate synthase is required for the synthesis of deoxythymidine from deoxyuridine. The drug 5-fluorouracil inhibits thymidine synthase, and by inhibiting thymidine synthase, it will inhibit the production of deoxythymidine triphosphate needed for DNA synthesis, thus reducing replication, cell division, and growth. The synthesis of thymidine by thymidylate synthase can also be inhibited by methotrexate, because thymidylate synthase needs THF in that step. So thymidylate synthase therefore can be inhibited by one of two drugs, fluorouracil or methotrexate.